So, Catherine, you're here today a little bit over 4 months after I did your surgery.
Right.
And your surgery is different because it was a very invasive surgery. We actually broke your heel bone and realigned it and repaired your tendon in the ankle, and I put a big screw in your heel. And
Yes.
so pretty dramatic. And you're 4 months out now, and you work in the school system and you
Yes.
teach, which means you're on your feet all day
All
long.
day.
So how are you doing?
I'm happy to report I'm doing very well. I have no discomfort in the areas that you operated on. I have just moved right into the orthotics fairly easily, and I feel really good about what's happening, and that I'm really on my way to being back to normal.
Well, I'm going to kind of tell your story, if you don't mind, about what you had. You had a basically stage 2.5 tibialis posterior dysfunction, which most people don't know what it is, but it's basically a tear in the posterior tibial tendon where the ankle starts going sideways and you start pronating to the point where there's no arch, and the tendon basically starts tearing. And remember when you first saw me about, what has been about 9 months ago, right?
October, I think. Yes.
Yeah.
Yes, and I was in quite a bit of pain.
Quite a bit of pain, and also remember how your ankle was really pronating to the point. I mean, there was no arch whatsoever. So, and you were, I think when we met, you were in a brace, right?
Yes. Yes.
And you saw somebody else, and I mean, you were young, and I just couldn't imagine spending my whole life in a brace like that. I mean,
Right.
somebody who is maybe 85 years old and not a surgical candidate, but in situations like yours, I definitely recommend trying surgery to see if we
Yes.
can correct it instead of dealing with the consequences of a tear.
Right, right.
So
I feel like we made the right decision.
I think so
don't,
too.
I have never thought I should have done anything differently, and especially now that I'm over the recovery, because
Right.
it is intense. I will
Yes,
tell you,
yes.
that was not fun.
No.
However, now that I'm on this end,
Uh-huh.
I'm very glad I did it. I think we made the right decision.
Yeah, I think so too.
I do.
Because the thing is, if we didn't do anything, it would have eventually torn completely. And once it tears, you go into that stage 3, which very quickly becomes a stage 4. And the only way you can do is basically you have to fuse the subtalar joint, which is, if you thought this was invasive, that surgery is definitely, I mean, we have to fuse basically 3 joints.
Yeah.
And so you're just too young to have a fusion,
Right, right.
So I would definitely, and this is really to prevent a fusion, hopefully in the future.
Well, that's what you said, and I hope so too. And you did give me some arch back. I have
Right,
arch in that foot, really more than I probably ever had to begin with.
Right.
Before the problem started,
Right.
so I'm very thankful.
And I mean, you were a trooper, but I can tell you, for 4 weeks before you can really put any weight on it, it's very hard, and there's pain. But I think that as long as people do it to get long-term resolution of pain,
Yes.
it justifies the means.
I agree.
Don't you agree?
I agree.
Yeah.
I agree. And I will say to other patients is do what the doctor tells you to do as far as being so careful in your care, your home care.
Right.
Because I went by the letter of the law, and I
Right.
feel like that helped me heal faster.
Absolutely.
I really do. So,
Absolutely, and you did great. I mean, you're
thanks.
really probably the top 5% of how well you've done.
Wow.
So,
Great.
So, well, thank you. All right.
Thank you.